Perfect. Okay. Okay, you're on.
We are on.
You're on.
All right. Well, welcome. Welcome, everyone. I hope you can see and hear us okay. My name is Peter Rossi, and I'm here with Dr. Lauren Kropp this evening. We're at the Breast Center at Valley View Hospital, and we're really excited to be here with this audience. The topic tonight is top 5 questions with radiation oncologists. This is the 7th in a series from the Breast Health Center here on topics related to breast health and breast cancer. We're oncologists, so we're going to focus a little bit more on the cancer aspect of it. And we really are grateful for that you're joining us this evening. So, during this session, you can enter questions in the Q&A section of the Zoom, and we are monitoring this, and we will discuss these questions at the end of our presentation. Our presentation will be fairly short. And just to begin with, my name is Peter Rossi, and I'm a radiation oncologist. I've been with Valley View Hospital and the Callaway Young Cancer Center for going on 6 years now. And I'm joined here by our newest associate here, Dr. Lauren Kropp. And
I am also a radiation oncologist, and I recently relocated from Florida to join the team here at Valley View. And I'm very excited to be here and to participate in this virtual session tonight.
yeah, and so we put together common questions that we get every day with our breast cancer patients and survivors, and with all our patients. It's going to be general, but we can be very specific as well. So do share your questions. But how about we begin?
So we'll start with some of the top 5 questions that we get as radiation oncologists. So question 1 that we typically get from patients is, what is radiation exactly? So Dr. Rossi, how do you typically answer that question for your patients?
Yeah, and hopefully you can see our slides here that, spell it out very simply as well. So we're radiation oncologists. So we use radiation to treat cancer. Traditionally, surgery is used, perhaps chemotherapy or systemic therapy or targeted therapy may be used. Endocrine therapy is a form of that. And then radiation is used. And radiation is different than the other two, but it is very targeted, and it's very personalized to the patient and the scenario that we are treating. But at its basis, it's just X-rays.
So X-ray is similar to how you would go in for a chest X-ray. That's the same process that you would feel when you're getting radiation treatment. So it is a non-invasive treatment. And we have a lot of indications for where we use radiation. Sometimes we use it in a combination with the other treatments that Dr. Rossi outlined. So we can reduce the risk that cancer comes back after it's been removed with surgery. We can cure some cancers by using radiation exclusively and preventing the need for surgery. And then radiation has a very unique role to provide symptom relief when there's advanced or metastatic cancers that can be painful or that can be nearby other organs and harming them. So we'll go through some examples of that. The first example where radiation reduces the risk of cancer recurrence is breast cancer. This is an example of a CT scan and a patient being treated for breast cancer. You can see where the surgery was. It was at the, hopefully you can see my pointer, but it's at this location of the breast. And then the rest of the breast tissue at risk is being covered with radiation. And you can see that careful designed radiation is attempting to avoid the ribs. And then on this section, you can see the radiation being targeted to this patient's breast, but avoiding heart and lungs. So that's a very important part of our field when we individualize treatment plans.
Yeah, this is what we call breast conserving therapy. So the idea here is do a minimal surgery that women recover from really readily. And the idea is to take out the gross or the visible cancer and to remove it completely. But with breast cancer, we know that's not the end of the story, because of the way the ducts work and the tissue is organized, there still can be microscopic disease left behind. And so radiation can come in, minimally invasive. Like we were saying, it's just like getting a chest x-ray. You don't see it, you don't feel it. It's given over a couple minutes in a couple of different ways, which we'll elaborate on, but and it takes care of the rest. So surgery is very important. It's curative in a lot of women, but the radiation is kind of the insurance policy to make sure we got it all and to make sure we save that breast for the woman's life. Is really the goal.
And this is a great alternative to mastectomy, which is the complete removal of the breast in a lot of early stage breast cancers. Want to take over this one?
Yeah, so this is an example. So this is a general kind of look at radiation. So sometimes we're in the situation where it's a more elegant area. And this is an example of a cancer that's in the neck that originated from the tonsil and above the voice box. And historically, if we tried to use surgery here, a patient would lose the ability to talk, to eat normally. And over time, we've been able to use radiation as the definitive treatment. So this is a PET scan on the left. And then on the right is how it's integrated into a radiation field. And for this person in particular, this is curative. So this is like a head and neck cancer, a tongue cancer, a base of tongue cancer, tonsil cancer, larynx cancer, all these kind of fall into that group where we use radiation alone curatively so that it goes away and never comes back.
And one of the most interesting things about this radiation plan is this blue-green area on this scan here is showing where the radiation is going, but more importantly, it's showing where the radiation is not going. So you can see that we have a very eloquent area of the body that we're treating, but we're able to avoid a lot of important normal structures on the parts of the body where the cancer is not involved, like the brain and the trachea down here.
Yeah, and these are word terms like you might see on Google: image guided treatment or intensity modulated treatment. Those are the kind of techniques we're utilizing to focus on the cancer and avoid everything else that could harm the patient.
And radiation has a very important role in really any metastatic cancer that's causing symptoms. This is an example of a prostate cancer that had spread to the breastbone, and you can see the PET CT images here and here, where this breastbone was involved by cancer, and it was very painful. You know, every time the patient would take a breath in and these bones and ligaments would naturally move with the respiratory cycle, they would experience pain. And so we were able to design a radiation plan that encompassed that area. And about 2 weeks of radiation treatments later, the patient had a complete response and was able to stop taking narcotic pain medications, and the pain really went away with this focused type of radiation that we call palliative radiation.
Yeah, I think it blows people's minds to see something like this. And if you look at that kind of anterior aspect of the breastbone, in this patient, that's actually prostate tissue that had a homing device for this gentleman's bone and took up residence there. And because it has a lot of nutrients and stuff, and it was very aggressive, took over and caused pain, and we're able to remedy that. And that's where cancer can harm people. So if we control it to begin with, we are hopeful that that doesn't happen, but this would be something that may happen where radiation can really benefit a patient.
So our second question is, how exactly does radiation work? A lot of patients want to know why they need radiation, especially after surgery, when they've had a good surgery and they have a so-called negative margin after their surgery where there's no visible cancer left. Radiation takes care of any microscopic cancer that's left behind, and it does that by damaging DNA within cancer cells. And the cancer cells do not have the mechanisms in place to repair from this radiation DNA damage. So our X-rays, are also called photons, come in and they damage DNA directly, or they create free radicals that further interact with the DNA, causing damage. The normal cells are impacted by this, but they are normal. So they have the intact mechanics to repair from this. And that's how we take advantage of radiation being effective to target cancer cells specifically, while normal cells have the capacity to repair very effectively from this type of exposure.
Yeah, it's really interesting. The history on this is this was discovered, radiation was discovered to treat cancer 130, 140 years ago, whereas we've only known really what it did to DNA to make that happen 50 or 60 years ago. So we've been utilizing this a long time. We knew that it selectively treated cancer while leaving everything else okay, and we take advantage of that today in a targeted way.
So a third question that we get very often is, how is the radiation delivered and what does the patient experience during the radiation treatment? Do you want to take this one?
Yeah, so what you're looking at there is what we call linear accelerators. So that's a very fancy X-ray machine, and it's generating X-rays that, even though we say they're similar to a chest X-ray, they're similar in the fact that you don't feel it or see it or smell it. They're different in that they're much more charged up. They're about 1,000 times stronger, and that's what we know gets after the DNA and makes the damage happen for the cancer to disappear. But that is a linear accelerator, and that's how radiation is delivered. So on the left of the screen there is where the radiation is coming out of, and it's focused very precisely and personally on that patient in this situation. And that machine might just stand still and focus conformal radiation. It may even move around to bring radiation from multiple directions, just again to be targeted and personalized while avoiding other things that might be nearby, specifically the lung and the heart in this woman.
Yeah, here's an example of how a patient would be treated for breast cancer. This is the linear accelerator, and the patient is typically lying flat on their back with their arms elevated. And then exactly like Dr. Rossi explained, the head of the linear accelerator will send the X-rays just through the tissue that needs it. So you can see in this woman, the breast is targeted, but the rest of the body is spared. And that's very important with radiation to decrease side effects.
Yeah, we have a lot of control over this. It looks like a beam of light, but it is very, again, personalized to the patient and to the target. And behind the scenes here, so this is in a big open room. We play music. It's dark just for comfort. But behind the screen here are physicists, dosimetrists, radiation therapists, Dr. Kropp and myself. We're there overseeing this on a daily basis as people get radiotherapy. And safety of radiation is the big issue. We always say safety is no accident, but we deliver tens of thousands of these treatments yearly at Valley View Hospital without any accident.
And we have accuracy that can be pinpoint to the 1 to 2 millimeter range.
Absolutely.
In some radiation treatments. Yeah, go ahead.
Yeah, well, I can take this over. So radiation isn't only delivered from the outside, and that is the majority of what we do, is what's called external beam radiotherapy. There's also something known as brachytherapy, which is the delivery of radiation internally, which also has a very long history. It goes back to the 1910s at Johns Hopkins Memorial Sloan Kettering, where we were treating cervical cancer and prostate cancer, tongue cancers, breast cancers, by putting radioisotopes into the tumor, directly on the tumor, or in the cavity that a tumor surrounds. So we have a lot of tools, and we utilize them based on the evidence of what is going to best benefit the patient.
And decrease side effects, both in the short term and long term.
Yeah, absolutely.
So that leads us to question 4. So what are the side effects of radiation? It's very dependent on where we direct the radiation. So if we're treating breast cancer and we're targeting the radiation at the breast, our most common symptoms during the course of treatment are skin reaction. And that's what's illustrated on this photograph. a patient that we're targeting the breast tissue, and you can see a very well demarcated sunburn type reaction over the breast tissue. This typically develops at the very end of treatment and takes about 2 to 3 weeks to heal. We've gotten very advanced with our radiation techniques to the point that we can individualize the treatment so much, even with the variety of breast anatomy that we come across in our daily practice, to make sure we minimize these side effects. In other sites that we treat, a general symptom of radiation is low energy and fatigue.
Absolutely.
But otherwise, it just depends where we aim it. But we are always cognizant of minimizing short-term symptoms, maximizing quality of life, and making sure any long-term symptoms from radiation are rare.
Yeah, absolutely. Patients come in and radiation is, I mean, it's weird and it's different. Not a lot of people have had contact with this. And we have to remind people we're more like surgery in some regards than, say, chemotherapy. People generally understand chemotherapy and surgery, but we don't cause full body symptoms. Like, you're not going to lose your hair. Nausea may be a part of it, but it isn't when we're treating breast cancer, because there's nothing that we're triggering that causes nausea here. So you don't get full body symptoms except for fatigue. That's really common. And it's not something that we can directly measure. Like, we know if someone's anemic, that's because they're low on their blood levels, and that's a direct risk, a direct symptom from that might be fatigue. We know differently, though. We know that when our women are getting treatment for breast cancer, they get tired. And there isn't kind of a direct cause of an effect, but it goes away and people return to their normal self very quickly after radiation.
And I have a number of patients receiving radiation treatment that continue to work during treatment. So the fatigue is noticeable, but it's not usually debilitating.
Yeah, I will often say, nobody except for who you share with would know that you're doing this. Radiation can be as little as 20 minutes a day in and out of your car, and you can go right back to work, and really nobody would know that unless you shared that. And that's the way we want it. We want you to, many women can maintain their normal life, during radiation. Absolutely.
So how has radiation improved? I think this is an important topic because we're always focused on decreasing the chances that this radiation is going to have a negative impact on a patient in the long term. So this is one of the classic examples of how radiation has improved for breast cancer. We've had improvement in imaging and technology where this is a sample radiation beam in yellow. And it's traveling through the breast tissue. And this would be an old method of treatment where the radiation actually passed through this structure here and overlapped with the heart. This is an important part of the heart where you have a major artery. And when we studied radiation that was delivered 20 or 30 years ago, a lot of these ladies that had this treatment later on had a higher rate of having some kind of cardiac problem as a result. It happened many decades down the road, but it was a noticeable difference over ladies who did not require this treatment. So now we do a breath hold technique where the lung is expanded and it provides a very nice buffer here for the radiation beam to really minimize dose to heart. And we use this quite often for the majority of our breast cancer treatments.
Absolutely. When I first started, we didn't really see what we were treating. And there's all these innovations and iterations. I mean, every couple months we're adding something new. The radiation, the disease control, we've been there for a long time, but it came with side effects, and we've been really, over my career, we're just reducing the side effects more and more. And we're really, that's what Dr. Krupp and I are committed to, is delivering the highest quality radiation possible at Valley View Hospital. And we really believe we can do that. And we have all these little tools and tricks to mitigate these side effects. And one of it is just simply doing breath hold. We actually have like 1 million lasers on a woman's chest, and we know if they move. And if they move, our machine stops. So there's no radiation delivered to where we don't want it at any time, and it benefits the woman.
And technology has really helped advance where our field to where we're getting these cure rates that we've historically had that are quite high, but minimizing side effects. This is just an illustration of the same technique where we see this breath hold technique now on the left. No radiation going to this structure here, the heart. But an older technique, same patient, but without the breath hold, you would see higher doses to the heart. Radiation has also improved over the years by getting more accurate and more diverse with our setup options and improvements in immobilization. These face masks that you'll see are used to keep patients very reproducible in their setup of their chin, their head, and their neck areas when we're treating this location of the body. You can see through it, this mask, and breathe through it, but it makes sure that all of the structures are aligned perfectly every day because many radiation treatments require multiple visits every day. We also have ways that we can position patients to further separate the breast from the critical structures like lung and heart by doing this kind of setup where a lady is face down for the treatment to make sure we displace the breast tissue maximally from those other organs. So we've had a lot of improvements and creative thinkers over the years that have really focused on how to deliver precise and accurate treatment.
Absolutely.
So those are our 5 questions.
Yeah.
I do want to point out that how has radiation improved? Well, it improves because we're all working together as a team, and we have a very diverse group of people here, from genetic counselors to radiologists, medical oncologists, Dr. Rossi and myself, that really all put our heads together for every patient that we see. And we really feel like the combination of all of our minds together is much more beneficial to the patient than just being treated by one provider.
Yeah, absolutely. And so just to kind of follow through on that, in your practice today, as you were in clinic, what were some styles of radiation that are courses that you prescribe for women with breast cancer?
That's a great question because it all depends on the type of breast cancer, the results from surgery and the pathology report, but we can do treatments for breast cancer that are as short as 5 radiation visits over 1 week and making it very convenient for patients if they're eligible for that technique. There's other techniques that we can limit radiation to 3 or 4 weeks. The old historical standard was 6.5 weeks. So we're getting shorter with treatments because we have this technology to provide the same doses of radiation over shorter periods of time.
Yeah, more targeted, more image guided, more personalized. And if once we understood more of what our target was over time, we've been able to shorten the course of therapy without increasing side effects. That's been a huge thing. Just now in previously 7 weeks of radiation now can be done in 1 week.
Yes.
It's
very beneficial for patients and it's very well tolerated.
Yeah, absolutely. Yeah, so those are our 5 questions, and we have a Q&A session now, which we are looking forward to. We actually purposely wanted to minimize this so that the audience had more time to ask questions. Has anybody signed up?
Yes, so a lot of people are saying thank you. This has been very helpful. Appreciate your thought process on many of the questions that people had. And some of them that came in, you kind of answered as we went through, but I might ask you some more detailed question. On average, how many radiation treatments do breast cancer patients need? And I know you just touched on that a little bit, but it sounds like it varies.
Yeah, it varies depending on the type of breast cancer. But we have a common regimen, which is 5 treatments Monday through Friday, get done in 1 week. We have other
For more earlier stage disease.
correct.
Yeah.
And then we have, when necessary to get the good outcomes that we want, the high rates of cancer cure, we have longer treatments that we can do within 3 to 4 weeks. But sometimes we do require a 6 to 6.5 week course for more advanced disease.
Yeah, it depends on the surgery the woman's had. Sometimes oncoplastic reconstruction goes along with it, and we slow down the radiation in those situations. Sometimes it's very advanced locally, unfortunately, where a lot of lymph nodes are involved. And so we have involve the treatment of the lymph nodes, and we slow it down in that case. So it might be 30 sessions or 33 sessions, but more commonly, we're talking about 5 sessions or 16 sessions, more or less. And each session is just a few minutes of radiation. Again, a woman comes in and has a schedule. It might be daily, Monday through Friday, might be at 9 a.m., but we're looking for them at 9 a.m. We're really respectful of the woman's schedule. They're out the door at 9:20. It doesn't interact with medicine. It doesn't make you radioactive. It doesn't reduce your immune system. So you could drive yourself back and forth if you choose. You can go right to work before or after.
We can have, you can hug your grandkids and hold your dogs, and there's no risk that they're gonna get exposed to radiation.
And you can bring your family and friends for support. We look forward to that. And actually, it brings up another point, which we're really proud about, is our integrative therapies. During radiation, it's a good time to kind of slow down. We can do physical therapy after a treatment. We can do everybody benefits from education on lymphedema, which is swelling that can happen after surgery. It's really uncommon to be chronic, but we kind of attack it up front with physical therapy. We can do massage therapy, healing touch, acupuncture. We have yoga for our survivors on a weekly basis. There's a lot of things like that we know improve patients' quality of life. So we're very invested in our integrative therapy program for our patients.
Great. We had a couple questions on integrative therapy, so that was perfect. I've combined a couple of questions. One is, how long does fatigue usually last once you're done with treatment? And then 2, do you have any tips and tricks on managing that fatigue?
Yeah, I can take this one. So, one of the best things to prevent it is to actually exercise. It seems counterintuitive, but there has been randomized trials that randomized patients who are all getting similar courses of radiation to exercise or no exercise, and it can be light exercise, a short walk, 10 or 15 minutes on the elliptical, something that most people are capable of doing physically, and that can really help prevent the fatigue. The recovery of the fatigue depends on a lot of different factors: how healthy and active they were before treatment, their age, and any other cancer treatments that are ongoing.
The other treatments really add.
But typically a month for energy level to be, 80-90% of normal, and then sometimes up to 8 weeks to 3 months to get full recovery from a course of radiation.
Yeah, absolutely. It's hard, to go through a lot of cancer treatment, and you have to respect your body. If you need an afternoon nap, you need an afternoon nap. Exercise on a daily basis really matters. Focusing on good sleep habits, minimizing or having no alcohol really helps, and eating a healthy diet, a least processed diet, 2 cups plus vegetables a day really goes a long way to mitigate these side effects and making the fatigue go away.
Perfect. I think that's the last one, unless anyone slides any more in. Are there ways to mitigate or ease the impacts of radiation, particularly to the skin?
Yes, great question. We focus on skincare throughout radiation on a rolling basis because everyone's going to have a slightly different degree of skin reaction just based on their anatomy and where we're targeting. So Dr. Rossi and myself check in at a minimum of once a week to do a skin check and to prescribe medications or give patients techniques on how to manage it. And so we're very involved during the course of radiation to make sure that we prevent it. But if it does happen, that we're providing recommendations on techniques to manage it as best as possible. We try to do that without breaking the course of radiation because we know radiation is most effective when it's delivered straight through. But one of the newer treatments is very, very simple that's been shown to prevent radiation skin reaction for breast cancer is using a mild steroid cream twice a day during treatment. So it's very easy to do.
It's just a topical intervention. We're not talking about taking pain medicine or things that cause drowsiness. It's just improvements in radiation technique. It's improvement in our prescription topical medicines that have really gone a long ways to help women out during the course of therapy, and then they heal really fast.
Great. Well, lots of thank yous, and definitely we thank you for doing this.
we're grateful to be here. I'm really pleased to introduce Dr. Kropp to the Valley and to our Valley View community and to the breast health center here and welcome her as a breast care provider here. This is the 7th in a series that we're launching from this platform, and you have access to all of them. And so I encourage you to go back if you have interest and look at the other topics. Again, thank you for attending tonight. The next webinar will be March 15th, so roughly a month from now. It will be at 6 p.m. and it will be presented by our wonderful genetic counselor, Kim Burns, who's a genetic expert, and all women with breast cancer. Most people with cancer qualify for genetic counseling and genetic testing, and we're here for you. And she's going to describe that, speaking on genetic testing, what it is and who qualifies. Thank you.